Hi, this is Brandy from Mana Health Partners, bringing you another educational video from our series, and this one is on PCR testing for urinary tract infection and wound cultures. So this is a PCR testing for molecular DNA, and we're focusing on wound and UTI cases. So the question is, why use molecular PCR? Well, it detects low levels of pathogens. It's got a faster turnaround time. It identifies a wide range of pathogens, including those that are difficult to culture. It detects genetic markers for antibiotic resistance directly from the sample, and it's suitable for multiple infections. So it identifies multiple pathogens in a single test. So the reason we're using the wound infection PCR and UTI PCR is because there's the reduction in turnaround time. It takes about 4 to 5 hours to run on a machine. So from the time they pick it up, about 2 hours to get to the facility, and then about 4 to 5 hours to run it, and then to get the results and read them. So we're looking at a 6 to 8 hour turnaround. So ordering in the morning, you get results back in the evening. So you don't have to wait the 72 hours to get the culture and sensitivity. It identifies difficult to culture pathogens that might not be as easy and might not show up on a culture and sensitivity. And it's very beneficial when we're talking about rapid diagnosis. It detects fastidious organisms that might not grow in a culture. And it's useful in recurrent or complicated UTIs when microbiology isn't necessarily sufficient for routine cases. So here's a copy of what one of the results may look like. We have two different types, this one and then the one choice report, which is very good. This is the urinary tract infection by PCR. And you will see that it talks about all of the different organisms that it has run, and all of them are not detected except for the Enterococcus faecalis. So we know that that's the organism that we're dealing with here. If we go on, we'll see the one choice report that Ecolab has utilized. So there's multiple areas on this that are of benefit to see. So one path system uses a database to highlight the suspected pathogens. So up here you can see that you've got some Candidae, E. coli, Klebsiella pneumoniae. So these are the organisms that were detected. Then you've got the antimicrobial resistance ARC score. So this is telling us that we've got a resistance detected and it's ESBL. So your MRSA and your MSSA would come up here as well. Patient allergies are accounted for in the treatment option. So this is the patient's allergy. And then adverse reactions. So this patient, and I'm not sure you can see, there is the drug of choice was this, and the adjustment needs to be made for this. So if you've got a patient in renal failure or renal disease, you would want to adjust the dose based on that. Also, side effects are listed as well as interactions. Anyone with an ACE inhibitor, we would want to change that medication. You can also scan the one choice right here, and that would give you it on your phone, so you'd be able to look at this report. It talks about the level of complexity. We're talking about a high risk infection here, and obviously with ESBL, it would be at high risk. And then here is what the pathologist has determined would be the optimal drug of choice to use in a simple urinary tract infection. Remember, we've got E. coli, we've got Klebsiella, and we've got allergies listed below. We've got an ESBL infection. And so if we're talking about a simple urinary tract infection, this would be the drug of choice. Now, if you don't like that drug of choice, there are other drugs of choice that you could use as well. So it's up to you to make the determination of what medications to give to the patient. Just because this is the ideal antibiotic does not mean that it's ideal for everybody. So macrobid would also take care of this infection if it's a simple UTI. Fosfomycin a little bit unusual of a medication. It's some powder you pour in and then add water, and then you take it one time. It's also good for simple UTI. Cipro, which has a black box warning, which wouldn't be our drug of choice, but we could use it for a simple UTI. And then if we've got a complicated UTI, we could use ertapenem here, either IV or IM, and then it gives you the time span for that. They've also listed fluconazole on here. Even though the candida is not bolded, they still show that as an organism that was found. In parentheses down here, it is a common organism that's detected and is all often colonized. So based on that, they're saying you treat that judiciously. If the patient has something like vaginitis and we know that they have candida in there, then yes, we would absolutely use fluconazole if they have a potential for it. If they're not showing any symptoms of it, it's not bolded, and the chances are that it's probably colonized, which is why that didn't make the top list and that's not bolded out. So then it asks, why is this one choice? Why is this the drug of choice? Well, because E. coli and Klebsiella pneumonia can be treated with this medication, as well as these medications. That's why you have alternatives. And are there special considerations? Absolutely. So again, contaminated samples, samples that have colonization in them. So yes, they can. An example of a urine culture, it talks about macrobid being the drug of choice. So it's the best medication based on a simple UTI. Now, a simple UTI is a female without a UTI over the last 90 days. So then you've got other medications which may be appropriate for both possible simple as well as complicated urinary tract infections. So a complicated would be a male or a female with a history of a UTI in the past 3 months. So a little bit closer up in a personal scale, this would be your drug of choice, and then your list of other medications that you could administer. Ordering PCRs in point-click care. So I've just got this integrated lab order instruction. You guys all know how to put orders in. I wanted to review it very quickly. I will attach it in your email, but we're just going to go over a couple of quick things. First of all, when we pick our patient, we want to make sure we click onto laboratory. If we accidentally pick something else and we're in pharmacy and we change it to laboratory, it is not going to bring us into Echo Lab. So make sure you click on Echo Lab and make sure this comes up. That's how we know that we're actually in the system. Ordering a lab under other, or once you get into some other place and then click laboratory, will not bring up the lab. You're going to want to see it under the laboratory, and you're going to want to see the order in a specific way. So once you get here, you're going to, I always like to have my name right here and then set as default. Nobody else is using my password, so I like me to be the default provider that comes up. So I'm going to click that authorized, and I'll just set it as my default, and then I'll create my order. When you pull your order batch up, it will give you common tests on the screen. One thing that Ecolab did for us is they put on our common lab screen urinary tract infection PCR, as well as the wound infection PCR. So those are on the common list for us now. So we don't have to go searching. But if you had to search, you could go searching for PCR under order description. It will show you multiple PCRs. It will show you PCRs for flu, etc. So, but the ones that we're using here are going to be the wound and the urinary tract infection ones. You're going to select your diagnoses. All the time that I put them in, all of them are selected. So I unselect and then I just pick my main one and I click OK. And then my communication method is me writing it, and then priority routine, or if you want it picked up now. If you want it picked up now, change it from routine. If it's routine and you don't need it until tomorrow morning, which I'm not sure why you would ever wait a whole day if you think they have an infection, you schedule it at 00:15. That's a midnight lab, and it will show up on the manifest report. Otherwise, I would schedule it for stat, and then I would have the schedule date as today, and I would tell the nurse to call it into Echo Lab and have them come and pick that up. The facility manifest report is what the facility night shift is supposed to run. So if there's ever a question on what they're supposed to do at night, this will be attached in your email as well. And it just walks through the manifest orders. So you pick any patient, whether they have a lab or not, and you go and click laboratory. Once you get to the laboratory, you can click that manifest report. Once you click the manifest report, you can come in, you can pick the date, you go to new manifest, today's date at midnight, and then it's going to show you all of the patients that are due. It will also print out the requisitions. So if the nurses are not familiar with this, and all facilities have been trained, so if they're not familiar with this, you can just email this to them or print this out and give it to them. They need to be doing this every single night so that the labs are being done. The phlebotomist doesn't know who they need to collect, and they don't know what PCRs are waiting for them in the fridge unless there's a manifest report. So they have to do that. How you as an NP are going to print out the labs that are scheduled for today. You're going to go into the reports, order listing, select the category of laboratory. I usually date range it about 2 days, but maybe over the weekend I might do 3 or 4 days to make sure that Friday, Saturday, Sunday's labs, whatever their list of labs are, and then to cross them off to make sure they're done. And then I run the report. So here are the steps up here above, and I'm just going to go under reports. I'm going to click order listing report. I'm going to select order category, and I'm going to select lab. And then my date range is either going to be a couple of days or the last 2 days. I want to make sure that all of the labs that were ordered are actually completed. And then you're going to run your report. So who clears the lab orders? That's the question, because they don't automatically disappear off of the active order list. So when the night nurse runs the manifest and the lab has been completed, they, the night nurse, should complete the order. If this is not done by the night nurse, then you're going to want to report this to the DON or unit manager so they can determine to go in every single morning at stand-up or clinicals to clear those orders. Those orders need to be cleared, and they need to disappear off of the active order list. They've already been obtained. So I just walk you through to go to the order, click actions, and click complete. Easy enough. So the order here was a CBC and a CMP, and I click the actions. The action drop-down box is view, update, and complete order. I'm going to click complete order, and then I'm going to sign it off, and then it's done and it goes into the inactive box. Frequently asked questions. So any labs that don't say sent have not been completed. They need to be obtained. Verify that they're not in your results. And if they're not, you need to order them ASAP. And then you're going to report to the DON that a lab was missed. PCRs are picked up after routines orders have been completed. So they'll pick up the routine labs, draw them, take them out, then they'll come back and grab the PCRs and start getting them run. If you need to get that PCR picked up, you add it to the Ecolab system, and then you have somebody call or you call for a pickup. This takes approximately 6 to 8 hours, as the lab runtime is at least 4 hours on the machine, 4 to 5 hours running that, and then the pickup time and the resulting time. Stat labs, not PCR labs, but stat labs must be called into Ecolab. Any questions about this? You can go to Ecolab's website, which is amazing, because when you go to Ecolab, you are going to come to their webpage. So ecolabgroup.com, and under training or testing resources, there's training information. So it talks to you about instructions for collection. So if the nurses ask you, can I get a straight cath, or they're not continent, so I can't get one. There's also training videos on here, but instructions for collection. So UTI brief collection. So you can actually take the swab and run it in the brief in the wettest area, as long as it's not contaminated. And that's how you get a brief collection. And then you can get a UTI in a cup and a wound collection. They even walk you through respiratory collection. But utilize that information right here. Give this to the DON, forward this to the DON, so that they understand what role they play and what role we play. It's super important to understand that we are co-partners in this lab system. So not only are we ordering PCRs, but we're following up on the PCRs. They do the middle steps. They're the ones that call. They're the ones that clear the order. They're the ones that make sure that it's out of the system. We're the ones that write the orders, and then we have to follow up. Don't write a PCR. Don't write any lab and then not follow up. So just follow up on your labs the next day. So my email is down here, bbabin@manahp.com. My phone number is here. You have access to utilize me anytime. Feel free to do that. I appreciate you taking your time today. I know you guys have a lot on your plate, and this is just one more thing, but it's going to make your life so much easier. It's going to give you the answers to what antibiotic needs to be implemented. It gives you the dosing and the time frame that you're going to continue antibiotics for. That's my little doggy behind me. So any questions, call me. Otherwise, have a great day. Thanks for your time, and we'll talk to you soon.